nurse today, and I'm going to be doing your well physical assessment. How are you doing?
I'm great.
Good. Is it warm enough? You feel comfortable?
I do.
Good. Okay. At this point, I would make sure that the patient is comfortable. She's warm enough. I provide for privacy. I would wash my hands and put on some gloves. This is a 52-year-old white female who appears her stated age. She appears clean and well groomed. Her dress is appropriate for her age, gender, and the season. Her posture is erect. Her position is relaxed. Her body movements are smooth, coordinated, and voluntary without any trouble in her body movements. Her behavior is appropriate for the situation. She is awake and alert. Her facial expressions, her mood and affect all match. Her speech is clear, fluent, without any trouble understanding her. She has good eye contact. And now I'm going to assess her cognitive thought process. So I'm going to tell you 4 words. I want you to repeat them back to me. So, fun, ankle, carrot, and loyalty. Repeat them back to me.
Fun, ankle, carrot, and loyalty.
Okay. Now I'm going to ask you some more questions. What year is it?
2016.
Who is the President of the United States?
Barack Obama.
What city do you live in?
Red, Georgia.
Okay. What did you eat for lunch?
Roast, rice, gravy, green beans, and corn.
Okay. What was your first job and where was it at?
Teaching in Cordell, Georgia.
Okay. So this patient is alert and oriented ×3. Her remote and recent memory are intact. And she answers questions appropriately and in a timely manner without any distraction. Can you tell me those 4 words back to me?
Fun, ankle, carrot, and loyalty.
Okay. Memory test is passed. Now her thoughts seem to appear logical and consistent with how we're speaking in our conversation. I'm going to ask you some more questions. Do you ever feel like you're being watched, followed, or controlled?
No.
Okay. Do you feel like you have your imagination is over in abundance?
No.
Okay. Do you ever hear your name being called when no one else is around?
No.
Okay. So she is aware of her reality and her perception of reality is intact. Where do you see yourself in the future?
I'd like to retire from teaching and possibly do some substitute.
Okay. So her judgment is intact. She's answering the questions appropriate for her age and her situation. Now I'm going to get into the physical assessment. So let me see your hands. All right, her skin is even tone, lightly tan pigment color. It is appropriate for her genetic background. Her skin is intact. It's warm and dry to touch. No lesions, rashes, bumps, or bruises noted. Her vascularity is within normal limits. No bruising noted. I'm going to pinch right here. Her skin turgor is good mobility, no tinting noted. Let me look at your hands. Her nails are well groomed and clean. No clubbing noted. Capillary refill less than 3 seconds. Now I'm going to palpate the head and the hair. So I look in the hair, make sure there's no lesions. There's no pest inhabitants noted. Her hair is good texture. It's shiny. Fine, straight, blonde hair. And now I'm going to do, I need to stay up. I'm going to do the head. I'm going to palpate the head. Her head is symmetrical for her body. No tenderness upon palpation, no lesions, bumps, bruises, anything like that noted on the head. I'm going to feel her temporal arteries. They're palpable. No asclerosis noted, no hardness noted. I want you to open and close your mouth, okay? No crepitus or TMJ noted. Her face is symmetrical for her body. There's no obvious deformities noted. Her color is even pigmented. The neck is held. It holds the head up erect and still. The neck muscles are symmetrical with no obvious deformities, no masses, no bruising, no bumps, lesions, anything like that noted on the neck. Turn your head to the right. Turn your head to the left. No jugular vein distension noted. Now I'm going to go through a series of range of motions, okay? So do what I say. Put your chin to your chest, okay? Tilt your head all the way back. Turn to the right. Turn to the left. Good. Now, as best you can, put your ear to your shoulder without lifting up your shoulder. Okay? Okay. The neck is supple. The movements are smooth and controlled. Now I'm going to test the thyroid. First of all, I want you to take a sip of water, and I'm going to watch the thyroid tissue. Okay? Thyroid moves up whenever she swallows. I'm going to come behind the patient. Okay? Now, I want you to take a sip of water, but hold it in your mouth. Okay? Turn your head to the left. No, tilt it. There you go. All right, now swallow. Okay, take another sip of water. Tilt your head to the right. Swallow. Okay. The thyroid is non-palpable, and no nodules are noted. Okay. Now I'm going to look at the lymph nodes of the neck, and throat. I'll take that. Okay. So I'm going to palpate right here. The pre-auricular, post-auricular, occipital, the submental, submandibular, jugulo-digastric, the superficial cervical, the deep cervical chain, and the posterior cervical. And I want you to take your shoulders, kind of bend them in and forward. Okay, the supraclavicular, all those nodes are soft, non-tender, and movable. Now we're going to do the eyes. So the eyes, the eyebrows, eyelashes are all symmetrical. They're appropriate size for the face. The sclera is white. Conjunctivity is pink. The eyeballs fit in the socket appropriately. They aren't protruding out or too sunken in. Now I'm going to look at the interior ocular structures. So her iris is round, evenly shaped, and the cornea is without abrasions, no redness, drainage, anything like that is noted. At this point, I would do the Snellen chart. I do not have a Snellen chart with me, but what I would do is I would place it 20 feet away from the patient. I would get the patient to stand up. They would stand in front of the chart and look and tell me. We would go through the different levels of the Snellen chart and go to the point where the patient can't read anymore. In this example, I'm going to say that the patient's vision is 20/30, which means the patient can see at 20 feet that a person with perfect 20 vision could see at 30 feet. We also do the near vision test. So we'd hold this about 14 inches away from the face, and I would get you to read the lowest line.
Give us a call today for more details about this exciting program.
Okay, near vision is intact. I do not have an infant or a child here, but in order to test the infant and the child's vision, for the infant, I would take a light and I would shine in the infant's light, and their eyes should blink. And that's the light reflex in the infant's eyes. I also would take the light from the corner of the infant's eyes, and you should see the pupils react at the same time. And at that point, you could say that the infant's eyes are equal, round, and reactive to light. For the child, you could do what's called the Allen's test, which is like the Snellen test chart, except it's picture cards, and you would get to where the child cannot see anymore. You can also do the color vision test, so you'd have cards that are of different colors, and in one color is either a letter or a number, and the child should be able to tell what that letter and number is, and that checks for color blindness. We also would do what's called the confrontation test on the child, and we're going to do this on my adult patient now. So this is checking the peripheral vision. I want you to cover up your right eye. Okay, I'm going to cover up mine as well. Now I'm going to hold out this orange pen, and when you see it out of your periphery, you say now.
Now.
Okay.
Now. Now. Now.
Okay, cover up the other eye.
Now. 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 Now.
Okay, so her peripheral vision is intact. It should be whenever she says now is when I see it as well. The extraocular movements, the muscle, I'm going to make sure those are intact, and when I'm doing this, I'm also going to be checking for nystagmus. So it's called the 6 cardinal positions. I want you to follow my finger as best you can without moving your head. The extraocular muscles appear to be intact. No nystagmus is noted. So the pupillary light reflex, the way I'm going to do that is I'm going to shine the light in from the side of the eye, and the pupils should react at the same time. Okay, they both constrict at the same time, so they are equal, round, or reactive to light. The corneal light reflex, I want you to look at me, look at my look at my nose or even my ear. Okay, I'm going to shine the light at her nose, and there's a sparkle in her eye that's symmetrical, so the corneal light reflex is intact. For children, we test for strabismus that's younger than the age of 6. By doing that, we do the corneal light reflex by showing this, pointing the light in their eyes, and you see the sparkle. We also do what's called the cover test. So I would cover up the patient's eyes. I would tell the child to look straight at my nose, and the patient should be able to hold a steady gaze. So when I cover up this eye should still stay steady looking at me. When I uncover it, this eye should fixate on the same object. The same would be for this eye. Okay. The steady is fixed and unchanged, steady gaze. No strabismus is noted. Next, we check for accommodation. So I want you to stare off at an object, okay? Accommodation is noted. Next, I'm going to do the eversion of the upper eyelid. So it's checking the conjunctivity and any lesions in the upper eyelid. So what I would do is, here, face this way. There you go. All right, I'm going to take this Q-tip. I'm going to lift the eye up. I'll look and see that there's no foreign bodies, no lesions, extra redness or anything like that noted. I would do the same thing for this eye. I would hold it down, lift up. Conjunctivity is still pink, good color, no color change, no foreign objects or anything like that noted. I would also gonna palpate the outside the ocular eye. So what I need you to do is look down. Okay, I'm gonna feel the eye. No redness, tenderness, swelling noted on either eye. I'm gonna also feel for like the lacrimal ducts apparatus, and there's no drainage or anything like that. Tenderness noted. Now, I do not have a fundoscope, but what I would do with the fundoscope, I would look in each of the patient's eyes. The red reflex should be present. We should be able to see the retina, the macula, and the optic disc. They should all be intact. Next, I'm going to do the ears. So the ears are symmetrical for the head. They're good size, good shape. They're the same color as the rest of the face. No masses, lesions, sores, anything like that. Obvious deformities of the ears. For a child especially, we would look for the alignment of the ear. So turn your face that way. Okay, so for a child, the corner of the eye should go to the top of the pinna. And that's one of the things that we check for like Down syndrome, because for a Down syndrome child, the ear is going to be a little bit lower set, and it's going to be tilted back a little more. So a child that is symmetrical would be the pinna and the eye would be at the same level, and the vertical degree from vertical to where the ear is would only be 10 degrees. We would also do an octoscope examination. I do not have an octoscope, but what we do is I would get the patient to turn. I would do this to each ear. I'm just going to demonstrate it on one ear. But with the otoscope, I would flip it upside down so my hand would be braced against the patient's face to prevent any like jarring or hurting the patient. I would look in the external auditory canal. Notice that it's intact. There are no foreign objects in there. The tympanic membrane should be intact and translucent. The malleus and umbo should be present and noted. The cone of light, the reflex, you should see in the ear in the 5 o'clock position in the right ear and the 7 o'clock position in the left ear. Next, we were going to test for hearing. So I would come on this side. We would do it called the whisper test. So I'm going to put my finger on her tragus of her left ear and move it in and out to distort the sound. I'm going to whisper in her right ear.
5B6.
Okay. And then I would do the same thing to the other ear. I'd come on this side, press in the tragus of the right ear, and I would say 3 letters and words.
7, 6, 9.
Okay. According to the whisper test, her hearing is well and intact. The Romber test. So how we're going to do this, I'm going to get you to stand up. Okay. put your feet together, put your hands by your side. Okay, and close your eyes. Okay, you would watch her for like 20 seconds, make sure she doesn't move or she's able to stay still and hold her balance, and Romberg's would be negative. Okay, you can have a seat. Next, I would test for the hearing and acuity in infants. And the way I would do that is I would get out of the peripheral view of the infant. I would clap my hands really loud or drop a book or something. And a newborn would do what's called the Moro reflex. So they would startle and jump. An infant between the ages of 3 to 4 months would stop what they're doing and they would listen, and they would blink too. A child between 6 and 8 months would try to look for the sound. They would hear it and they would try to look for it. So that's how we would test the hearing in an infant. Now the nose. The nose is symmetrical. Midline, no obvious deformities, no masses, no pain or tenderness upon palpation. Appears to be symmetrical and in line. What I want you to do is press in your nose on one side. Okay, breathe in. Okay, do the same thing for the other side. Okay, nose is patent. Now I want you to pull your nose up like this. I'm going to look in. The nose is, the nasal mucosa is pink, moist, no redness, drainage, bleeding, anything like that noted. The inferior turbulence are also the reddish pink color that match the rest of the skin mucosa without any drainage or anything noted. I also looked at the septum. There's no perforation or bleeding noted of the septum. And then the sinuses. So what I would do is I'm going to palpate right here, and I would palpate here. No pain or tenderness noted of the frontal or maxillary sinuses. Now I'm going to look in the mouth. So we get the patient to say ah, stick out their tongue and say ah. I'm going to use a T.
Ah.
Okay. All right. Now I'm also going to take this. I'm going to look at the tongue. Stick out your tongue. I'll look from side to side. Okay. I want you to put your tongue to the roof of your mouth. Okay. And also look down at the at the bottom of the mouth as well. Okay. So the mouth and mucosal membranes are pink and moist, and no obvious deformities, sores, redness, bumps, anything like that are noted. The teeth appear to be intact, nothing loose or missing, and I want you to bite down on your teeth. Okay, so the teeth are normal alignment too. There's not an overbite or an underbite. Next, I'm going to look in the throat. Notice that the throat is pink. Mucosa is moist, all that, so there's no lumps, lesions, sores noted. The tonsils, stick out your tongue. Okay, the tonsils are present in grade 0. And I think that's it. That completes the first part of the physical assessment. Thank you.
Yes.